Hi, Kevin. How are you?
I'm fine, Sarah. I'm fine.
Good, good.
Looking forward to this afternoon.
Yes, yes, yes. Now, here is something that comes up a lot at the charity. We receive tens and thousands of questions on this subject, but I'm going to stick to the two most popular questions today about medication.
Right.
The first one, will medication cure my anxiety?
Right. Okay. I'm going to give a little bit of context because I've looked up latest facts and figures, which surprised even me because I knew these figures were very large, and I'll have to put my glasses on for this. But I've just looked up the data from the Office of National Statistics in the year 2019 to 2020, 12 months. There were 74 million prescriptions for antidepressants.
Wow.
And that involved more than 7 million patients. So bear in mind that some people might have one prescription, some people have a prescription every month, some every 2 months. But that's, by my calculation, that's about 1 in 7 of the adult population of the United Kingdom.
That's huge.
It's eye-watering.
Yeah.
Now, the prescriptions for antidepressants have gone up. The prescriptions for tranquilizers, which are still an issue for a lot of no panic members, they've come down quite a lot.
Mhm.
So the figures I've got for those for the year 2019 to 2020, that 12-month period, 13 million prescriptions for 2 million patients. Now, I know of that 2 million patients on tranquilizing medications, but some of those have been on that medication for decades.
Yeah.
So there is a lot of information there. And obviously today, I'm going to try and keep it short and sweet and simple, but it's a complex area. And 74 million, I didn't think, I was thinking it might be something over 60 million because that was the last time I looked. 74 million prescriptions. So this year it's going to be more. I
Yeah.
mean, I'm anticipating it's going to be closer to 80 million
Mm,
for
mm.
2021. But there we go.
Huge.
So that's the context. Now, on a positive note, if used properly for the right patients, for the right conditions, antidepressant medications can be very effective in reducing anxiety. I don't think that anybody suggests they're a cure, but they can reduce anxiety to reasonably normal levels in a lot of cases. And the particular forms of anxiety that seem to be most responsive are general anxiety disorders.
Mhm.
Now, sometimes people respond well to just simple self-help and exercise and breathing exercises and meditation, sometimes some CBT. But if you don't respond to those, the outlook for antidepressants, if they're used properly,
Yeah.
at the right dose for the right length of time, and I'll come on to that in a second, they can be very effective.
Mhm.
So just because you're offered an antidepressant doesn't mean to say the doctor thinks you're depressed. It's a guideline treatment for general anxiety disorder. And of course, if you've got GAD, general anxiety disorder, you might be depressed. But the primary reason is to reduce your arousal and reduce those anxious thoughts.
Yeah.
So it's a very good, effective treatment. And I know we're going to put up on the website two NHS links.
Mhm.
Actually, the first one is about antidepressants, and the second one is about the anxiety states, general anxiety disorder.
Mhm.
The two other conditions that are particularly responsive to drugs, and I've seen spectacular results in some cases, are severe obsessive compulsive disorder,
Mhm.
where psychological treatments haven't worked. Now, there is a class of drugs that's recommended by NICE, selective serotonin reuptake inhibitors, SSRIs,
Yeah.
commonly used drugs. They're used in higher dose, but they can really change the patient's life for the better. So there's every reason to be optimistic. The third condition is post-traumatic stress disorder. Now, it's not a first-line treatment, but for people with severe post-traumatic stress disorder who are also receiving an evidence-based treatment like cognitive behavior therapy or EMDR, antidepressant treatments can be really, really effective. Now, nobody's really sure, although there's lots written about it, nobody's really sure how they work. But if you go to those NHS websites, you'll actually see plenty of information. And for anybody who wants a lot of information, because it's all there, you can go to NICE guidelines, the National Institute for Health and Care Excellence, NICE, just tap it in. Every single guidance has got a lay summary. So there's a summary written for the general public. So these drugs are used very, very widely. Whether they're used too widely is another matter, but they can be very effective for some of the anxiety disorders. So I think the message should be upbeat, really.
Yeah. Okay, that's great. The second question that we see all the time is, how do I come off medication?
Right. Now, it is established that can be a problem. And I've got, today, I just looked up again, just to refresh my memory, some excellent guidance from the Royal College of Psychiatrists. Now, we're going to put that up on the No Panic website. There is a link there, and you can download a PDF. So it's a very good link, and it's written specifically for the general public. Now, it says that normally you don't need to take antidepressants for 6 to 12 months, but we know that many people take them for much longer than that for all kinds of reasons. Now, the Royal College of Psychiatrists have taken the research, and they say that between a third and a half, I'm reading now from their guidance, between a third and a half of people who take an antidepressant will experience such symptoms, withdrawal symptoms, to some extent. We cannot yet predict who is going to get these symptoms. Now, there is a lot of very, very helpful information about coming off them. It says that you should come off them with help from your GP or your pharmacist. Now, pharmacists are an extremely good resource because they know everything about the drugs. They know a lot more about how these drugs work than a lot of doctors do. A good clinical pharmacist, or indeed a prescribing nurse, because an independent nurse practitioner can be a prescriber. Now, I think there's another just issue that needs to be addressed, and that is, if you're under the care of a psychiatrist, you should be going to the psychiatrist for help and advice. But this guidance says that withdrawal symptoms come in all shapes and forms. The guidance gives very helpful information about which drugs are more likely to give you withdrawal symptoms. It also says that there's all kinds of ways of coming off. And I know by my own experience of patients coming off antidepressant medication, that might take a long time. But I think the guidance is of the, I suppose, of the spirit that says easy does it. You're much better to take longer to come off the drug and come off it completely than to try and rush it, because if you rush it, if you stop it abruptly, you'll probably get a resurgence of everything. You'll get withdrawal symptoms, and you'll probably feel worse than when you started them in the first place. So we can't, obviously, I can't, and No Panic can't give individual guidance, but I think what I'm suggesting is we've got 3 excellent resources there. So on one hand, we've got a negative message about withdrawal symptoms, but on the other hand, we've got a positive message that if these drugs are used properly and they're used for the right people in the right way, they can be very effective. But first of all, you've got to try self-help, cognitive behavior therapy, all the therapies that we know to be effective. I think there's general agreement that before you start an antidepressant medication, those things should be tried before you start to embark on a medication, which is going to take some time to work, 3-4 weeks before it even begins. And then you're going to need to stay on it 6 to 12 months. So try the simple things first. No Panic website, exercise, relaxation, meditation, mindfulness, etc.
Excellent. Well, that's some excellent advice. I'm sure you've answered many people's questions with that. But like you say, everything's over on our website. Those links are going to be up, and I think each person, we just to stress that one more time, everybody is an individual, and we can't globally, nobody
No,
can
we can't.
say what's right, what's wrong for you. Only
No.
your GP, psychiatrist, etc. can go over that with you. But if you do have any questions, anybody, please send them in to us, and we will answer all of them. Thank you very much, Kevin, and we shall be speaking again very soon.
Okay.
Take
All the
care.
best.
Bye-bye.
See you soon.
Bye-bye.
Bye.